Welcome to the Freeman Hospital. My name's Lynsey Robson. I'm the Urology Nurse Specialist. Your GP has referred you to the unit because he is concerned that you may have a testicular cancer. I'm the first person that you will see when attending the hospital, and I'm going to take you through a step-by-step guide of what will happen to you on this appointment. This is the main entrance to the Freeman Hospital. For your appointment, there are parking facilities at the front of the hospital, and this is the main entrance that you will come through to attend the Urology Department. Once you enter the main entrance, you need to follow the signs for the wards and departments. Alternatively, there is a reception desk and the staff there will be more than willing to help you. So at the end of the corridor, this is the sign to the Urology Treatment Suite. You will need to follow this and it takes you up to level 3. This is level 3. Once you come out of the lifts, you can follow the signs for the Urology Treatment Suite, and we're just going to walk along this corridor. You've now reached the Urology Treatment Suite. I'm going to take you in to book into your appointment. So once you're into the treatment suite, follow the sign for reception and we'll book you in for your appointment.
My name's John and I'm the receptionist, and when you're booking for your appointment today, I'll ask for your name, your address and your date of birth.
So you've now checked in at the front desk. I've got your notes, I've got your referral from your GP, and I'm now going to take you into the consultation room. So your GP's gave me a bit of information, and basically what he said is that there's an abnormality with one of your testicles. So what I'll ask when you come into clinic is for you to just explain a little bit to me about what's been happening. How long have you had the lump in your testicle? Is it painful when you touch it? And if there is anything else that you want to discuss while you're in the clinic appointment. I might document some of the information that you tell me, and once we've had a discussion, I will then fill out an X-ray form, and you will attend the X-ray department, and this is for an ultrasound scan to look at both testicles. I've now filled in an X-ray form, and this is what I'm going to hand to you, and this is what you must take down to the X-ray department to hand in to have your ultrasound scan.
Hi, my name is Stenberg. I'm a consultant sonographer at the Freeman Hospital, and on a day-to-day basis I perform ultrasound scans. This is an ultrasound machine, and if you come for an ultrasound scan, this is the type of equipment we'll be using to scan you. When you come, typically we would ask you to lie on our bed and for us to perform the scan. We would then use a range of different probes, and it's a bit like having your picture taken with a camera. This is an ultrasound probe that we would place gently on your skin, and it would use sound to make pictures. It's completely harmless and it's completely painless, and we get some nice photographs at the end that will tell us, hopefully, what the information that we need to know. Now, in order to get good contact with that probe, we use jelly. Now, the jelly can be a bit cold, but we put a bit of jelly in just so we get good close contact. And other than that, you just need to lie and relax and let us do our job. It's very easy, very straightforward, and most of all, it doesn't hurt at all. The report will be available for your doctor the same day that you have the scan done. Now, it can vary how long it'll take for you to see your doctor, but the results should be with them as soon as they need them.
You've now returned from having your ultrasound scan, and we now have confirmation from the ultrasound scan pictures plus the report that you've brought back to me in clinic that there is a suspicion that there is a testicular tumour. So I'm now going to introduce you to Mr. Heer. He's a consultant urologist at the Freeman Hospital, and he will perform the surgery to remove your testicle.
Hello, I'm Rakesh here. I'm one of the consultant urologists, and this is often the attire that you may see a surgeon wearing. We wear theatre greens, and depending on which hospital you might be at, they may be blues. And I'm now involved because you have a diagnosis of suspected testicular cancer. The mainstay of that treatment now is going to be to have a surgery. When you come in for your surgery, it'll involve an anaesthesia when you'll be asleep. So you won't know too much about what's going on. But during your sleep, what the surgeon will do is make a small incision in your groin area. That's this area here, and it's an incision that is about 5 to 6 centimetres wide, and through that area we can deliver the testicle from the scrotum up and out, and we remove the testicle from that incision. Afterwards we can replace the testicle with a prosthesis, a silicone testicle, which we pass through and down into the scrotum. And this area which is open, we will subsequently stitch and close. You'll come back from theatre and wake up with a dressing over that area, and you may even have a scrotal support. That's a very tight-fitting underpant. You usually go home the same day. However, in some cases, they may ask you to stay overnight.
So you've now heard about the surgery from Mr. Heer, and one of the things I need to guide you through is your pre-assessment appointment. So this is where I will take you down to the pre-assessment suite, and you will meet a nurse who will guide you through the next procedure to make sure that you are fit enough to have a general anaesthetic. So this is the pre-assessment clinic, also known as Clinic H, and I'm going to take you through for you to have a seat, and Sister will be with you shortly.
My name's Alison and I'm a nurse practitioner in the pre-assessment clinic at the Freeman Hospital. When patients come through to pre-assessment, we go through a full health questionnaire which involves taking a history about medications, any operations that you've had in the past and any past medical history. After which we check your blood pressure, pulse and oxygen saturation levels, take MRSA swabs of the nose, throat and groin and a urine sample. When we take a blood pressure, this involves having the cuff placed on the arm, and this takes a few seconds and goes up quite tight, but as I say, it only lasts a few seconds. And the reading comes up on the monitor, and then we'll place a probe on the finger, and this tells us how well oxygenated the blood is. And again, that comes up on the monitor. And then you may need to have an ECG, which is a heart tracing. We also take some blood tests as well. Once the pre-assessment process is over and you've had all your tests, it takes 3 days for the results of your MRSA swabs to come back. Your blood results are looked at the following day, and if everything's all right with the pre-assessment, the notes are then sent to the waiting list officer, who will then send you out a date for your surgery.
So it's now the day of your admission for surgery, and this is Ward 1 where you will be admitted to. I'm going to take you through, sit you in the day room, and Sister will be with you shortly.
Hello, my name's Judith Heckles. I'm Sister on Ward 1 at Freeman. You've come in today to have a procedure, so what I'm going to do is take you along to a cubicle, and there are a few things that we need to do: admit you, prepare you for theatre. I'll introduce you to the rest of the staff on the ward, and I'll show you around the ward. You may come into a cubicle, which is a room just where one person's in. Now in the cubicle, obviously we'll have the bed and the television if you're wanting to watch the television while you're in. There's also a radio on here. Sink. Now there's not a toilet in here, but there's a separate toilet which is next to the day room. Now you may, if you don't come into a cubicle, you would go into a bay where there's 6 beds, so you would be in with other patients. Once we bring you into the room, we have to go through an admission process, and that is going through all your details, your past medical history, any medical problems that you may have if you were a diabetic, anything like that, any medication that you take. Then we go through a checklist, which is for theatre. We just go through your observations, your blood pressure. We ask you when you last had anything to eat or drink, and we go through a checklist and fill all those details in. Once we've gone through all your details and filled in your checklist, we'll go through what you have to wear for your procedure. What you have to wear is one of these gowns. It's like a dressing gown, but it ties at the back, so it goes on like that, ties at the back. You have to take all your clothes off, including your underwear. And then you also have to wear a pair of stockings. This is to try and prevent you getting problems with your legs during theatre. And they're just like normal socks, go up to your knees, and you wear those and they stay on for the whole of your admission, and they get taken off once you go home. During the admission procedure, when we're doing your checklist, we'll also have to do your blood pressure and your pulse and your temperature. This is to make sure everything's fine, ready for you going to theatre. This is the machine, and the cuff goes round your arm and inflates up, and this gives us all the readings on this monitor here, and that lets us know if everything's ready and it's safe to go ahead with your procedure. Once we've finished with all the details, all the nursing documentation and your blood pressure and your observations, the doctor will be the next person who comes to see you, and he'll explain all about the procedure, get you to sign a consent form, and then once he's finished, the anaesthetist will be coming to see you, and he's the gentleman who puts you to sleep, and he'll go through all the anaesthetic details with you and give you an opportunity to ask any questions that you're not sure about. After the operation, you'll be brought back to the ward, to the bed where you were when you started off. You'll be in bed, and the nurses will come and check you, and they'll do a regular check of your blood pressure and your pulse and your temperature again to make sure everything's fine following the operation. If you're well enough and you don't feel sickly, you'll be able to have something to eat and drink. You'll also have had some painkillers probably in theatre, but if you need painkillers on the ward, they'll be wrote up regularly for you. Once you feel well enough and you've been to the toilet to pass urine, you'll be able to go home. When you're ready to go home, we'll be preparing some dressings for you to take home, and we'll go through all your dressing details and what you need to do and what's expected when you get home. You'll have an information sheet. We'll also provide you with some painkillers unless you have any at home. This is to help, because you do need painkillers for a few days just to make sure you're comfortable while you're at home. We may arrange a district nurse unless you can manage your wound at home, but we'll check that before you do go home to make sure you are managing. The doctor may come and see you after the procedure, and he'll go through everything with you, and all the follow-up care will be discussed with you before you leave the ward. During your stay, there'll always be staff around to help you. All the nurses and the doctors will generally be on the ward. This is the nurses' station, and you'll always find that there's doctors or nurses sitting here, but there's always somebody around if you need assistance or you just want to ask somebody a question.
So this is the central operating theatre, and this is where you'll come for your procedure.
Hello, my name's Richard. I'm a theatre orderly. I go for patients on this trolley here, and when we're finished with the trolley, they go into theatre, and when they've been into theatre, they go into recovery. Normally we bring the beds down, or they go back on the trolley, back to the ward.
So after you've been discharged from the ward, you will receive an outpatient appointment to come back to my clinic for me to review you. At this appointment, I will ask you how you've recovered, and in particular, I will check your wound to make sure there is no evidence of infection or a collection of blood called a hematoma. You must tell me at this appointment if you are experiencing any pain around the wound or if you've noticed any oozing on the dressing. The other thing I'm going to do at this appointment is take some blood tests, and this is to check your post-operative tumour markers, which you will have had taken before your surgery. At this point, you may also be wearing a scrotal support, and if this is helpful, then you can continue to wear this for another week or so. However, if you are recovering extremely well, you may wish to remove this and just continue with some regular painkillers or analgesia. One of the other investigations you require is to have a CT scan, and this will be performed in main X-ray. This scan is to look at your chest, your abdomen and your pelvis in order to assess whether there is any evidence of the cancer spreading outside of the testicle. You will receive an appointment for this in the post, and this will be done on an urgent basis.
My name is Janet. I'm one of the radiographers here at the Freeman. My job role is to check that I've got the right patient. So I'll just go through their full name, date of birth and address when they're in the room again, and then I will give them some clear instructions. It may be some breathing instructions that they'll need to do for the examination. Once I'm happy that I've got the right patient, I'll lead Craig over to the board. I'll ask him to stand in the position that I need him to be in. So once I'm happy that Craig's in the right position, I will go over to the tube and I'll make sure that I've got everything on by using the light switch on the tube, and I'll use my collimators, and that light beam tells me exactly what I'm going to be getting on the X-ray. I go behind and make sure that I've got my details up on the screen before I make the exposure. And once I've done that, I can tell him to relax. The results are reported by our doctors, and that'll get sent to his GP or the referring clinician who's requested the exam.
Thank you.
All right, take care.
At this appointment, I will discuss your histology results, where your testicle has been looked at under the microscope by a pathologist, and they will have sent us the specialist information that we need in order to see if this has been a cancerous growth that has been in the testicle. So now we know that it is a confirmed cancerous growth. I will refer you over to my colleagues in oncology to discuss your follow-up and your treatment plan.